our fall 2023 alumni tabling event. My name is Diana Davidson. I am a second-year MPH student in the School of Public Health, and I'm also the current Vice President of Alumni Relations, or VP of Outreach with Delta Omega. So I'm thrilled to welcome you all today. It's fantastic to see our alumni faces come back and be enriching and sharing their journey with our current students of public health. This gathering is a testament to the enduring spirit of our alumni community and the importance we place on staying connected. So without further ado, let's dive into this enriching experience and make the most of our time together. So to give an overview of today's session, I will begin by introducing each alumni, who will then go on to introduce themselves. The alumni will share information about their educational background, career pathway, what they're doing today. Each alumni will have a maximum of 5 minutes for the introduction. And then after that, there will be a Q&A session open to the audience members who can ask a general question to our alumnus or any specific questions they may have for a particular alumni. So without further ado, I'm happy to introduce our first guest speaker, Dr. Elizabeth Clayton.
Hi, thank you so much. I'm so excited to be here today. I think some of you might know me since I'm still at the school, but I have a dual bachelor's degree from Vanderbilt and then went on to do my MPH at Yale, focusing specifically on social and behavioral sciences. Got an MS in chronic disease epidemiology because I wanted to have a focus on both areas, and then came back to West Virginia to do my PhD in social and behavioral sciences. So I graduated in 2018, and then I started my position as assistant professor in social and behavioral sciences in August of 2018. So I've been excited to be here ever since. I mostly teach undergraduates, master's students, and PhD students, and I do a lot of research that focuses on eating disorders in pregnant populations, and also maternal and child mental health. I'm really excited to talk to you all today.
Thank you so much, Dr. Clayton. I'm esteemed to announce our next speaker, who is going to be Dr. Marcus Speaker.
Great, really fun to be back here today. A little bit different than Elizabeth. I started back, in the late 80s at WVU with undergraduate degrees in electrical engineering and chemical engineering, or not chemical, but computer. And then I shifted into the master's program there at WVU in community health education, which got grandfathered in. And I think back to some of that early work with Dr. Kirshner and Ken McPherson and that group with our our classes were over in the Coliseum at that point in time. So very different. After that, shifted and went into medical school and did my residency in family medicine, and then put my computer skills to work, going on further to become board certified in clinical informatics. And now I'm serving as the Associate Chief Medical Information Officer in Roanoke, Virginia with Carilion Clinic, 8-hospital system, $2 billion a year in revenue. And I deal mainly with clinical decision support and our Epic instance. Up at WVU, I think that you all call that Merlin, but really working on provider efficiency. Back in during the pandemic, we did a lot of public health work with immunizations and setting up our testing clinics. But today we're a little bit out of that, and so more specific with the EHR, but glad to be back today and talking with you all.
Thank you so much, Marcus. I will now be introducing Dr. Danielle Davidov.
Hi, everybody. Good to see some faces that I haven't seen in a while. I'm Danielle Davidov. I'm an associate professor in the Department of Social and Behavioral Sciences in the School of Public Health at WVU. I have been here for a while. I got my undergraduate degree at Marshall University, and I'm from Fairmont, West Virginia originally. So I went down to Marshall for my undergraduate degree in psychology. And then I came to WVU, and I was in the first cohort of PhD students. And that was back in when it was community medicine. And so I certainly remember the days of Ruth Kirschner and was a TA for her and worked with her quite a bit. And then I got my PhD in public health and a graduate certificate in women's studies, and kind of had grand plans to go somewhere, anywhere that the wind would take me. And I ended up staying at WVU. Originally got a position as a research coordinator in the Department of Emergency Medicine, which over time transitioned into a faculty position in emergency medicine. And I was doing clinical research, mostly in the area of intimate partner violence and trauma, the intersections of that with substance abuse and mental health. And that whole time I maintained a secondary appointment in the School of Public Health because I love teaching and I really wanted to teach. So I was sort of doing that on the side. And then in 2018, I kind of flip-flopped my appointments and became a full-time faculty member in the School of Public Health because I really missed public health. Not that clinical research isn't great, but I really missed, doing the public health type of thing and being surrounded by a lot of students and faculty that had similar interests as me. So I have been in public health full-time since 2018. Just doing some research on evaluation of programs to prevent or reduce violence in college settings, community-based settings, healthcare settings, things like that. And I'm working with a lot of students on dissertation committees and teaching classes in qualitative methods, intervention design, social determinants of health. I have been teaching undergrads for a while, which I really, really enjoy. But now I'm focused mostly on doctoral and master's students. So I think that sums it up. Thanks.
Thank you so much, Dr. DeVito. Now I'll be introducing Liz Early.
Yep. Hi, thank you. Can you hear me?
Yes, we can.
Hi, my name is Liz Early. I am alumni class for WVU. I think I graduated in 2011. And I currently work at Merck, the pharmaceutical company, in the research laboratories. My background is a little bit I feel like I'm a little bit different than a lot of the students that you see come out of the program. So I started off I'm a little scatterbrained right now. My undergraduate, I went to Allegheny College, which is in Northwestern Pennsylvania, as I'm originally from Pittsburgh. And my background is in communication and psychology. And I graduated from the MPH program in 2011. And from there, I went into the research field where I really spent a lot of time and specialized a lot in the non-interventional research field. So doing a lot of qualitative research, community health-based research. And then from there, I took kind of a right turn and I made the jump over to pharma in, I think it was like 2014, and I've been there ever since. So my current role at Merck is I work on the team in Merck that does all of the publication, that supports the publications that we sponsor across the company. And I feel like at this point in my career, I've done a little bit of everything. So really happy to be here.
Thank you so much. Next, I'll be introducing Dr. Sherry Owens.
Hi, everybody. It's great to see some familiar faces. I was in the social and behavioral cohort, I think a little, maybe right around the time Liz was there as well. So I have my PhD in social and behavioral sciences and had the pleasure of taking classes with Dr. DeVito. So after my degree in social and behavioral sciences, during that time, I sort of discovered programming. And so I got into SAS programming a lot, which led to an opportunity in pharmaceuticals and translational sciences, analyzing biomarkers, And I've since sort of stuck closer to home in biostatistics and epidemiology, and have worked in a variety of positions in industry and academia, but I am currently the director of biostatistics and programming at Tyra Biosciences, where I work in SAS and R and developing statistical analysis plans and doing a lot of what we do in research, just in a little.
Alrighty, thank you so much. Next, I'll be introducing Marco Mascocci.
Hello, everyone. Great to be here. Happy to also see some familiar faces. Yeah, so I actually have a long and storied educational career here at WVU. I just can't get enough. I did my my bachelor's in biology way back in the day. Like so many people thought I was going to go into medicine. That ended up not being for me at all. I had the opportunity to pursue my MPH in health policy as well as my MBA at the same time. Graduated back in 2019 and actually picked up a position with what was then to become the WVU Health Affairs Institute. It's been through a couple of name changes since then, but I've continued to, I guess, pursue my education at WVU. When the pandemic started, I used my newfound rent money and decided to pay for a master's in economics at WVU, and I am actually currently enrolled as a PhD econ student. So, you know, never stop learning, I guess is what I'm saying. As far as career pathway, before I started my master's, I worked as a medical scribe, primarily in the Ruby emergency department. Did some, I also did a student health and also a Department of Orthopedics. Long story short, after 10,000 patient visits, I realized that direct patient care was not the place for me. So I thought I would pivot to more of a healthcare administration. Did a fantastic internship with the Center for Quality Outcomes at WVU Medicine. And I learned also that was not the place for me. So sort of by chance, and maybe this is helpful to some of the students, but I basically walked into my health econ class, and Dr. Lindsay Allen, who was a faculty member at the School of Public Health at that time, had a stack of positions printed out, and she said, anybody who doesn't have a job yet, maybe one of these would suit you. And I had just been taking Dr. Duvall's quantitative analysis class. We were working in sort of R, and that was really my first exposure to that type of thing. And I said, hey, that sounds interesting. And next thing I knew, I was hired as a health data analyst within what was then to become the Office of Health Affairs. I think I was the second employee at that time. And now I am the longest tenured. So I've been there for since 2019, so almost 5 years. Have kind of, you know, I've moved up some and have additional responsibilities. So the description for what I do is I work as an embedded analyst within the Bureau for Medical Services, which is West Virginia's Medicaid agency. Our role there is we work on a secondary data set, which is generated from billing. So for anyone who doesn't know, whenever you go see a provider, in order for that provider to get paid, they have to send in a standardized claim form. And payers, so insurance agencies, but also Medicaid agencies like mine, end up with these databases that have, you know, hundreds of millions of entries of every single visit, every single prescription that was filled for their beneficiaries. And we're able to track things like, what are people getting diagnosed with, and what services are they receiving, and what drugs do, you know, are they prescribed and receive, and also how much everything costs. So as you can imagine, a tremendously rich data source. And I've been spending the last couple years just digging into that and just really falling in love with something that I never would have imagined. I mean, definitely when I started, I would have never thought, hey, I'm going to be a SAS coder, right? Like in on administrative billing data, but I, absolutely love it. I would highly recommend it to a lot of people. It gives you a lot of flexibility, and it's always interesting. There's always something to learn, and I have some additional duties in a database administration role. Do a little bit of policy analysis, but the quantitative stuff is what really speaks to me. So thank you.
Thank you so much. It seems like a very diverse background going on. I love it. And last but not least, I am esteemed to introduce Taylor Schultz.
Hello, my name's Taylor. I graduated in 2020 from WVU with a bachelor's in public health and a minor in human services. My career path has kind of been short, but a little all over the place at the same time. So in college, I was working for Ronald McDonald House and really fell in love with nonprofit work. And then I was also working with the health department, but wasn't full time. So I needed to find something that I could get full-time hours on. And nothing was really working out for me. So I decided to take a leap of faith and start teaching. So in Preston County, I taught special education, this very profound classroom, 6 through 8 middle school at West Preston. Because in Preston County, they need special education teachers so badly that you don't have to have a teaching degree. You start with a bachelor's degree and then you take additional classes, but was not for me. But I took that chance anyway. So I was kind of looking again. I only taught for like 6 months, and the community engagement coordinator position at the Mon County Child Advocacy Center became available. And that was definitely right up my alley, something I've been looking for. So I applied for that and started in January of 2022. And then in last November, I moved up to the Director of Awareness and Development here at the Child Advocacy Center. And some of my main duties, which they're always kind of fluctuating, but I do our awareness and community outreach, our fundraisers and events, our social media, and most of our outcome data. But thanks for having me.
Thank you so much. And before we go into the Q&A, I did want to share that one of the alumni was not able to attend the Zoom session today, but she did share a short video presentation about herself, similar to the introductions we just had. It will be live on our YouTube Delta Omega channel at 11 a.m. So I just wanted to share that. It's with Dr. Lindsay Nakashi. So now we're going to transition into our Q&A. I wanted to offer, is there anyone in the audience who had a question to begin with? I have a few myself, but I wanted to offer if anyone else had one. All right, I'll get the ball rolling. So this is just a general question for all of you today. So what have proved to be the most helpful things you had learned or had done in your graduate program? Yes, Marco.
Yeah, I it's kind of funny. Like I said, I now work in a lot of data analysis work with, kind of a specialized program, main language being SAS, but that's not something that I had ever actually touched in my career. And I always credit as part of my MBA, I had to take a very specific finance class, which was almost entirely Excel focused. And I can't tell you how much it helps to get good at Excel. If you're gonna enter the workforce, it's weird to say, but Excel is how things get done, whether it's just organization or basic numbers. So highly recommend get cozy with Excel. And if you can show that you're good at that'll be beneficial in any area that you go into.
Thank you for sharing that. 100%. I had to learn Excel pretty fast in my summer internship. Yes, Liz.
So I know for me, while I really enjoyed all the coursework that I did while I was at WVU, what really kind of like sealed the deal for me in terms of like career paths was I was very fortunate to get a graduate assistantship with Dr. Zulig my second year, where I was working with him very closely on the West Virginia prescription drug abuse quit line. And while he was sort of the brains behind the the operation in terms of, he developed it and he was the one overseeing it, I was brought on to help with the back end part of it. So actually making everything happen. So if you think about classes like intervention design or research methods, it was a direct application of those practices. So what I did was work really closely with him and the different counselors to really understand, all right, so we wrote this protocol, we wrote this grant, so how are we actually going to collect this information? And it was my responsibility to monitor the database and really understand what the research was telling us, and then obviously report out on it. So when I saw that sort of like real life application of the things that we were being taught, it sort of, that was like the light bulb moment for me. And then from there, my first job out of when I graduated was actually working with at Nationwide Children's Hospital in their pediatric research department, where I was really fortunate to work with a really great PI who basically did the same thing. She had just gotten an R01 grant, which is a grant from the NIH. And she handed me the grant and said, here you go, make it work, like figure out how to make this all happen. And yeah, so that, and from there it was, that's, I guess the rest is history, as they say. So yeah, I would say definitely the real life application of the things that we were taught is really kind of what was really impactful for me.
Thank you so much for sharing that. I'm actually taking intervention design with Dr. Zulig this semester, so I'm definitely getting that application, trying to take everything I've learned and translating it into this project. It's taking time, but I'm getting there. All right, and Dr. Davidov, I saw you raise your hand.
Yeah, I have a similar, I guess, impactful experience, and it's similar to Liz's in that I think what I worked on for my dissertation, and not necessarily the project itself, but the group of people that I was able to work with and network with, provided me with invaluable experience and a network of people that I still keep in touch with and publish with to this day. So I was working on a randomized controlled trial to look at an intervention for intimate partner violence embedded in the context of home visitation settings. And it was this gigantic CDC-funded $5 million project, international team of people. And I was so, it was just so daunting. And I was so intimidated to work with these people and produce things. And I ended up collecting qualitative data for the developmental phase of this research. And if they had not thrown me to the wolves to do that, I wouldn't have realized how much I like qualitative research. And that's what I do today, is qualitative and mixed methods research primarily. I would not have found that out if they didn't sort of throw me to the wolves and have me analyze it. And it was through that experience that research questions sort of bubbled up in my brain that I could answer with my dissertation. So for me, it was like connecting with a good mentor, a good network of people that the mentor knew, and sort of embedding myself into an existing project where I could play a small but important role. And then from there, I have continued to work with that team of people, and my mentors from that team have reached out to other people on my behalf, and just sort of spurred this network that I'm grateful for. It's been invaluable in terms of working on grants with people and publishing with people, and simply just having people in a similar situation as me to reach out to. So I think that for me was the most probably important thing that I was engaged in.
Thank you so much for sharing that. And I actually have a question to bounce back off that, because you were mentioning this importance of social networks and how you're had these connections. What is the best way as like a graduate student to take that step to make those social networks, and how do you maintain it among the busyness of like, personal life and your work life?
Mhm. It's a great question. And this is going to differ depending on who you are as a student, what you're comfortable with, and what people you might be reaching out to. But the best thing to do is simply kind of like a cold email, right? It's best if you know someone that can connect you with someone you want to chat with, right? So let's say someone wanted to email me and Dr. Clayton knew them. She might send an email that says, "Oh, Danielle, please meet Diana. Diana is a fantastic student and she has similar interests to you. You all should connect," right? Done. And then you and I would connect. We might have a Zoom. We might go get coffee. We might chat. But that email that the student then sends on behalf, after that connection is, I think, really important. So there is sort of this balance to strike between not giving them a dissertation about yourself, but not saying, "Hey, I'd like to chat with you. Bye. Like, give me some times," right? So, always sharing a little bit about what you're interested in, why you're interested in it, why you think it would be nice to connect with that person, because you can really tell a lot from that quick introductory email. And that's not to put pressure on people, but, at that point, I've received emails and been like, "I'm really excited to talk to this person. It sounds like they are just fantastic student. Maybe we could work together," and they have great ideas, right? So that's, at least in the academic realm, what we're used to and what we expect. So just email. That's my advice.
Thank you for sharing that. I definitely will take that ahead as I graduate and I try to make those networks and connections, trying to find a career path. And then I have a second general question I wanted to ask the audience is, what are some technical and professional skills someone new to the field after like they graduate or they're in their second year of their program that they should develop to be successful in the future? All right. Yes, Sherry.
Sorry, I'm having trouble unmuting myself. I would just say, bouncing off of, I can't remember who said it, but about Excel, but data management as a skill in general, knowing the ways that you can mess up. Finding the ways that experimenting with data on your own. Coming into the workforce, it's like there's now so much data being produced all the time for groups of people who never thought they would have to deal with data. And I've been in so many jobs where they're just like, "Here's the data, do it." And those are the only instructions I have. And so just knowing how to create clean data is a skill that, if anybody ever wants to chat about it, let me know.
Thank you for sharing that. Liz, I saw you raise your hand second.
Yep, thanks. I would say it really depends on the setting that you're in, but I would say just as an overall, because like I've been fortunate to be able to get to work in both a nonprofit setting and a for-profit setting. So really the biggest impact that I would say is just being able to keep an open mind and just being able and willing to work and be willing to learn new things and be open-minded in terms of like what technology is available to you. When I worked at one of the jobs, I don't know if it was when I was at Children's Hospital of Philadelphia or somewhere else, but a lot of times, depending on what team you're on, they might not have funding to actually purchase like, software that would be really helpful for you to, do an analysis or manage your references or whatever. So a lot of times, Google's your best friend. You have to try to figure out like, all right, so I need to solve this problem, like, and this is what I have available to me. So you have to sort of be able to figure it out. But then obviously being at like I've been at Merck now for about 8 years, and obviously being at a large company that is very much a corporate setting. I mean, we have more technology than we know what to do with half the time. So Yeah, I would say just the biggest thing is, regardless of what setting you're in, if you just come into it with an open mind and just being, having that sort of attitude that, whatever wherever you are, whatever you're in, I might need to learn something new, or I might need to, make the best, with what I have available to me. I find that's what was really helpful.
Thank you. I definitely agree that we have a lot of technology we don't know how to handle and use just yet. That's very relatable to the field. And then third, I saw Marco, you raised your hand.
Yeah, so I would say something that really has the potential to set you apart is just your ability to communicate, whether that is, just being able to talk to people, or more important than ever is just like written communication. So you need to be able to get your point across effectively using emails. And what I always tell people is just like start reading. Like you don't have to like read 100 books a year, but like if you can just start making that a habit of yours, the more you read, the better you're going to be able to write. And that's something that, there are so many people that can do the data part better than I can, but I'm able to effectively communicate. And that is, whenever people want to know, like, who should I put on my team, right? Like something like that makes a huge difference. So, just pick up a book from time to time and practice writing.
That's a fantastic piece to share, especially when working with qualitative data and gathering a written report. I think those are very important skills. And then Dr. Speaker, I saw that you've raised your hand.
Yeah, so to bring a couple of these concepts together, we talked about networking, and I think networking is absolutely critical. And a couple good references there. Keith Ferrazzi has written a number of books. I don't know if anybody has read his Super Connectors or Never Eat Alone, but really gets to that notion of connecting and creating your social network and mentoring network. So that's one of the other big things that I would suggest as you're coming through the graduate program or your doctorate, and even once you get out, finding those mentors that are going to continue to help you develop, hone your skills, and kind of point you in that right direction. But I completely agree. Also, never stop reading, never stop learning. And one other place that I would be remiss without saying you may want to focus, and that's in the large language models and the generative AI space at this point. We've had conversations with our physicians and other providers, telling them, no, Chat GPT and others are not going to replace you as a physician, but physicians that use Chat GPT and other large language models are going to replace those that don't. So learn how to use those skills and keep up.
Those are great words of wisdom. Thank you for sharing. And then Dr. DeVito.
Yeah, I apologize if this has been said. I had to take a quick phone call, but I was just thinking about, someone said data management, also just project management in general. So if you're going to work at a nonprofit or you're going to be in academia, I think what smacked me in the face when I started my faculty position more than anything was how on earth do you apply for a grant? How do you write a budget? I still to this day avoid doing budgets if I can. Even if you have support, someone who's going to help you with that, you still are responsible, if you're leading a project, for allocating how much money goes where. And so things as simple as how much do you provide for a stipend, and what is F&A and what are indirects, those sorts of things, at least when I was in graduate school, nobody taught us. I heard those words thrown around all of the time, and I just thought that's for somebody else to figure out, not me. But when you become the PI, you absolutely need to understand every bit of that and create a budget and be able to finesse it to make things work, because you have a great idea, but Well, then, oh, whoop, you calculated something wrong. You have $50,000 less than you thought you did. Now what? Where do you cut? So to the extent possible that folks can just ask more questions. If you're involved in something like that, even something as simple as, where can I go to learn what you're saying right now? What were these words you're saying? Where can I Google to learn a little bit? And just have a tiny bit of background and context for that stuff. I wish I would have learned a little bit more when I was in graduate school.
No, that's a great point to share, especially with the whole budgeting thing. I don't know if I could personally handle that myself. And it's not sometimes typically translated in the realm of like public health, but I think that is a good point. I know in one of our second year classes, we're learning how we are given a budget and trying to like implement that within a needs assessment. So it's definitely been a roller coaster navigating through that. And Dr. Clayton, I see that you've raised your hand.
Yes, thank you. I agree with all the comments that have been shared so far in terms of the professional and technical skills you need, as well as just, some soft skills too. And one that I'd add to that is just time management. I thought I was so busy during my PhD and trying to handle all the things, and now I feel like I'm just doing multiple PhDs at once, all the time with all the different projects and papers. And so just trying to figure out how you're going to manage your time, how you're going to manage the various competing projects that you have, can be really helpful. And setting aside time, for whatever professional development you need or writing, especially in academia. I set aside about 2 hours a week to just write with a colleague to make sure that I'm accountable and actually getting papers done. So that's the wisdom I would share.
Thank you for sharing that. So I know I've asked a few questions. I wanted to open again to the general audience if they've had any questions based on what we've been discussing so far.
Yeah, I have a quick question, and this is just for the general panel. But what is maybe like a short-term change that you have experienced within your specific industry?
I can lead us off here. I don't know if this necessarily qualifies, but you know, everything with the pandemic, and again, is it short term? When I started this role, I worked in a cubicle farm, right? Like with 100 other people in a room, and now for those of us who work in the data field, right? Like there's functionally no reason for us to ever actually be in an office ever again. And I think it is uniquely freeing for, I don't know. I personally, I can't focus with distractions. So the amount of productivity gains from being able to work in my own quiet environments has been huge. But I think it is kind of like turned the entire industry like on its head a little bit, right? Like we're all learning to navigate that, and some industries aren't able to do that as effectively, and they're pushing back. But it's been an adjustment for all of us, right? Like so, and again, just to sort of repeat my earlier point, it makes the sort of remote communication like more important than ever, right? Like being able to figure out this is, people respond differently. Like some people, if you ask them a question of like, hey, how's your dog, right? Like that like is enough to get them to maybe respond to your email, or otherwise maybe it would just be ignored or sit there for a week. So it's a challenge, but it's been interesting.
Thank you for sharing that. Definitely the pandemic has caused some ripples, and it's really shown the challenges and boundaries that exist within our careers. Dr. Speaker, I've seen you've raised your hand.
Yeah, so one of the changes we've had significantly in the past couple of years is telehealth. So moving to hospital at home, where we have all sorts of devices that we can deploy in a home environment for patients, so they don't have to come into the hospital or into an office, and then just patient visits. So we're doing the televisits where our providers are talking to patients either over the phone and getting paid for it. For a long time, we didn't get paid for any of that, and now we're doing these video visits. They're scheduled. Patients are signing up for slots on their mobile devices, and so the whole notion of telehealth really has exploded. The technology, being able to create a box, like a mobile office that a worker can sit in with ear pain, and they can stick an otoscope in their ear, and the provider can look at that from miles away and give a diagnosis. The technology has really come a long way and allowed us to do that. But yeah, telehealth is huge now.
I'm a big fan of telehealth myself personally, especially when looking at public health in rural America and connecting with patients that might not have the transportation or accessibility to reach their clinicians, especially in like a more urgent time, or like even those preventative checkups. It's very important to have that. So I've been a big fan of it myself, especially during the pandemic. And anyone else want to add on to this question?
I can go. So speaking from the perspective of pharma, so over the last, I would say like 10 years, pharma has made a very concerted effort to start looking at, real world evidence, that's like the new buzzword in pharma, but basically non-interventional research. So things like epidemiology and the health policy research, those fields are becoming increasingly more important to stakeholders, payers, and other people in the field in general. And I would say that's been a big shift in just, I think, the research community as a whole, because I know like when I was at WVU, and it's not to say that that this message was given to me from WVU, but the general sense that I got was that, like pharma was kind of like the bad guys, or like the people that, worked for like for-profit companies, their motivation might not be as, I guess, pure as like a nonprofit researcher. Whereas like right now, like I can tell you and guarantee you that is not the case at all. And there's so much that, companies like Merck and others are doing to really, enhance the research field, and to really contribute to what's out there from the perspective of, I mean, we have a whole department of epidemiologists at Merck, and we have a whole team that they specialize in patient-reported outcomes, which is something that has really been very, very important in the last, several years, in terms of giving patients a voice in terms of their treatment, their overall health, their quality of life, the overall satisfaction with whatever it is. And a lot of that, I would say, we're working hand in hand with academic institutions, CROs, payers. So the US government, Medicare, National Health Service. So I would say, whereas I feel like, historically the trend has been sort of like a, very siloed approach. Now you see all the different entities working together, and it's been a really, I feel like it's been a really nice, very beneficial change for everybody.
Thank you for sharing that. All right, I have another question I wanted to ask the general panel, and that was, it considers in that, with the MPH program, when the first years are wrapping up their first year and they transition to their second year, that summer they have what we call a summer practicum. So it's where they have like an internship type experience where they're expected to get a certain number of hours to complete the professional experience and then develop products from that, or deliverables as we call it. So does your industry offer any internships or apprenticeships that these students could look into and apply for the potential to, do their practicum experience there?
I know the Health Affairs Institute always has student placements. So yeah, I'll have to get back to you as far as the specific contact information, but yeah, we're always looking for people to learn the realm, I guess, and excited to have our MPH students.
Awesome. That's great to hear. All right, Dr. Speaker.
Yeah, on the data side of things, we do offer some internships. Those kind of pop up in the summer. So if, again, this kind of goes back, if you have a little bit of knowledge with data and data reporting, sometimes there's some things that we can work out with our health analytics and our reporting team. Less so over in the clinical space that we're fairly inundated with medical students and they keep us busy. But yeah, so in that data world, there's always some opportunities.
Awesome. That's definitely great for all concentrations with MPH. You know, data is always going to be important wherever you navigate with that. All right. So I think we have time for just one more question if anyone in the general audience wanted to ask something.
I have a question.
I was gonna say,
you can say, okay. So, as an MPH student that is going to go into the PhD, I'll be in school for so long. And one of my biggest fears is, what do I do whenever I'm outside of school? Like, I've only ever been in school my whole life. I don't know how to function without being in class. So if you have any advice on that, I think that would be great.
Dr. DeVito.
Yes, I have lots of advice on this. I struggled with this. I have loved being a student. I wanted to be a student forever, so I decided to stay in academia and have no desire to go into a real working world that is outside of academia. The times that I did do direct service, I realized that it was not for me. So that really helped me realize, okay, I don't want to be out boots on the ground working. However, again, just like the budget stuff, that kind of smacked me in the face. So once you're finished with school, no one is saying, you have a test in 3 weeks. Don't forget to study. Don't forget to study. I'm here if you need anything. Don't forget to study. So if you're doing anything that requires you to be a self-starter and independently do it, you've got to kind of do what Dr. Clayton was talking about with the time management and figuring out how to get things done without that built-in accountability. And so in my world, that looks like preparing a grant application or writing a paper. I have a track record now of taking years to finish a manuscript just because it is so difficult for me to sit down and get that writing done without that external deadline. And so one way I cope with that is with the people that I work with. I say, please give me a deadline. I will meet your deadline, but I can't, if it's self-imposed by me, I will run right over it. So I encourage the people that I work with for us to hold each other accountable. That's a huge part of it. And I think the other thing is sort of knowing what your strengths are is really important as you get into the working world. It took me a while to realize I didn't want to be the one leading the grant. I didn't want to write it. I didn't want to budget it. I would love to assist and help people. And I will lead the qualitative part or the mixed methods part. But oh man, I do not want to be the PI running the whole show because that has me under the desk with stress, right? So, but I love the position that I found myself in now, which is to be like kind of the methodologist. Love that. But it took me years to figure out that that was my strength and not, being the PI, because when you're in graduate school, what do you hear? Be the PI, be the lead, you're going to run the show. It took me a while to not even to question, do I want to do that? I don't know. And then when I really got into it, I realized that there was a different place for me. So I think looking at your strengths and keeping yourself accountable, however that looks.
That was some great insightful information for sure. And then Sherry Owens.
Yeah, I think this is a great question. And I struggled with this too. And I sort of struggled in a different way, but I still think relevant, where I was like, when you're in school, you don't set normal boundaries, or that was my experience, right? Like you work however you need to get assignments done. And so you're on a very sort of like college schedule. And when you're out in the real world, Friday afternoons, Friday evenings, till Sunday, that is your designated time off, and your evenings are your designated time off. And scientifically, we know that that prevents you from burning out and improves your overall quality of life and your work efficiency. But I didn't believe any of that. And I thought I needed to work 80 hours a week all the time. And I did benefit to a point where I did really experience legitimate burnout. And I just want to caution you about, or encourage you, I guess not caution, to understand that setting boundaries is okay. And maybe it's something that you can practice even as a student, just knowing that eventually you'll be in a more structured environment.
All righty. So I guess I'm going to ask just a whole wrap up, tie the bow to the session today. And I just wanted to ask to the general panel, are there any memberships to professional organizations or associations that you recommend that, public health students should look into within the future when they start their careers and maintain that career? Yes, Dr. Clayton.
I would say that APHA is one for public health students. I'm actually heading there on Sunday for their annual conference, but I think it's just a great organization to have ties to, and it's a huge network, which can be a little overwhelming, but trying to find your niche in it can be helpful. And the conferences have a lot of really good information and opportunities for you to present, to hear from others who are doing interesting work. So that's my membership. And then I also have membership with Academy for Eating Disorders, which is a more like field, like niche field specific. And so I carry that. And then I also go to conferences for that every year too, which is a smaller networking area, but both of them together really help build my professional development network.
Thank you for sharing.
I don't have one for this, but I saw Marco unmute for the last question, and I'm really curious as to what his advice was going to be.
Yeah, right. Well, busted. I was gonna say, my advice for adjusting to life after school is just literally just stay in school forever, which has been my plan. It's as someone who's probably going to be a PhD student until 40. My goal is to just, keep picking up a degree here and there, hopefully find an employer that'll pay for it. I think I've got, I wouldn't mind going to a war college or something, or maybe another MBA, maybe somewhere a little more prestigious. So just keep learning. That's fun.
All right. Well, I want to thank you all for your time today. I appreciate everyone for coming and attending and having such a great discussion among alumni and current students. We will be uploading the recording of this presentation to our Delta Omega YouTube channel later this week. And I hope you all enjoy the great start to your week. And I look forward to sharing any updates and Delta Omega events that'll be happening later this semester, and then as well as in the future next semester.
Thanks, everyone.
Thank you.
Thank you all.